All right. Well, good morning, everybody, and welcome to our prevention perk. We got a great conversation lined up for today. We're going to be talking about all things mental health first aid. I want to remind you that we have another in this series coming up on June the 3rd. We'll be talking about epidemiology, so we hope you can join us for that. And then we'll be announcing another planned schedule of prevention perks. Following that, we're lining up what that topic lineup will look like. So we'd love to have your feedback as always. If you have questions, comments, concerns about the prevention perk, suggestions for what we can talk about in the future, we would love to hear from you about that. And it can be about specifics pertaining to prevention of substance misuse. Today, we're talking about mental health. We've talked about green dot bystander awareness. We've talked about human trafficking prevention and awareness. So anything that has to do with, behavioral health issues in our communities, we would love to have you weigh in on that conversation, just like today. I know that both people that I've invited to talk about it have a wealth of information about the topic of mental health first aid. But we also know that some of you have experience either as trainers or your coalition members or leaders in the communities that you represent. And so if you have some experience, I know that one of the favorite things that Rachel always brings up when we get together for trainings is how do we get more people in the seats? How do we market this? And then the age-old question, where's the money? So fundraising and those kinds of things. So if you have those kinds of things that you can weigh in on during the course of the discussion today, we would love to hear from you because I think we would all be in agreement. This is a valuable resource for our community. And Rachel and I were talking before we went on that if you can't figure out how to get to some kind of a mental health first aid training right now in today's world, you're not trying hard enough because it's available in so many ways, shapes, and forms, and there's 3 different formats available. So we would love for you to give us feedback on where you stand on that today. But first, let's go ahead and I will step aside and let the experts entertain us, so to speak, enlighten us, educate us. Rachel Talby is, I don't even know your official title, Rachel, but she's all things mental health first aid for the state of Missouri. If you're a trainer, you probably were trained by Rachel, or I don't know if you do every one of them, but I think you've been at every one that I've gone through. So, and then we're going to have Samantha Sherman, who works here for Community Partnership, also share a little bit about what mental health first aid has looked like in Greene County in Southwest Missouri, because we've rolled it out in a couple of different ways for Greene County specifically, and then the counties that we serve in the region. And there's been a lot of people trained, and we've got a lot of trainers as well. So we'll let Samantha talk about that as we go along today. And then I'm curious about what it's going to look like in the future. Like what kind of grand thing can we all help? Not that we're going to make you guys do it, but what can we do to help make this thing even bigger and better than it already is? So welcome, Rachel. I'm glad you could join us today. And I like to just keep this as, just conversational as can be. So not everyone's going to know who you are. So you might want to introduce yourself and give some background on, your role in mental health first aid in the state of Missouri.
Yeah, awesome. Thanks, Steve. Appreciate it. So I'm Rachel Talby. I see many familiar faces here. And for those I haven't yet met, I'm excited to connect with you today. I'm in St. Louis, and I don't even know what my real title is, but I call myself a project director for mental health first aid. I work for the Missouri Institute of Mental Health. We're based out of the University of Missouri, St. Louis, right? So many things I'm glazing over already. And we work really closely with the Department of Mental Health in Missouri to help to bolster the efforts for mental health first aid around the state. So That's what I get the privilege of doing all day, every day. And I love it, and love to get the chance to connect with folks who are instructors, people who've taken the class, and people who might be interested in it as well. So thanks for joining us today. Can I get a sense of people's familiarity with mental health first aid? So I know a few folks in the room are instructors in the class. Can you either like use the chat box or give me some facial expressions, like you know about it, you've taken a class, not so much, still learning. Okay, so a little bit of variety there, so love it. Well, maybe, I don't know, Steve, you want me to start with a couple of basics about where the program came from, and a little bit of background, and then we can hop into any other questions.
Yeah, I think that'd be great.
So if you've been around mental health first aid, you've probably seen this koala popping up periodically, and that's because the program started in Australia. And oh, there we go, Steve even has his. And so the program started in Australia, and there's kind of some folklore about how the program started. A lot of times the story is told that a woman named Betty Kitchener and her partner Tony Jorn were walking on the beach. I think they were actually just walking their dog in their neighborhood, but the beach, sounds nice. And she was a nurse. She had a background in teaching physical health first aid and CPR. She also experienced depression and was kind of experiencing some discrimination in her workplace as a result of that. And so she said, well, why, we do this physical health first aid stuff all the time. Why don't we have the same thing for mental health? And so thus the idea of mental health first aid was born. Fortunately, her partner, Tony, was a mental health researcher. And so between the two of them, right, came up with a super cool program. And then in 2008, that program came to the United States. So the program was created in about 2000. And then in 2008, we brought it to the United States. And when I say we, it wasn't actually me, but Missouri's Department of Mental Health, the state of Maryland, and then the National Council for Behavioral Health helped to bring it to the US. So Missouri was in there right from the beginning, which is really, really cool to see their commitment and really ongoing support for the program too. So yeah, and then since then we've had like 2.5 million people trained in the program nationwide. And in Missouri, we just reached the 60,000 mark. 60,000 people have taken the class, which is about 1% of the population. So that's an exciting milestone, but like not nearly. Sometimes people are like, oh, everybody's taken mental health first aid, like 1% of us. And when people ask me who maybe would benefit from taking the program, I often say that people who know other people would really benefit. And I think most of us, even though we may not see people as frequently during this pandemic, most of us would say that we know some other folks who we could support by taking the class. So that's just a little bit about it. I can answer questions or share some thoughts amongst folks too.
Well, I want to say welcome to Cindy. She says she's the director at the Catholic Charities Lifehouse, and she's heard great things about mental health first aid and wants to be officially trained. So you're exactly who we're welcoming in today, Cindy. Glad you're here. And here locally, Samantha Sherman would be the person to connect with. She could see about you getting a training under your belt, so to speak, or trainings under your belt, or make it your life like the rest of us have. So you talked about, the number of people that have been trained. I'm assuming, do you know off the top of maybe you have those stats in front of you, how many trainers are there in Missouri? Like how many people of us are out there on the front lines?
Well, as of yesterday, I at first feel like maybe I should call out Amanda, who is among the 13 newest people trained as instructor first aid. So it's very close to 400 now. So very close to 400 instructors around the state. So it's a good solid group of folks, lots of people in lots of different areas, and definitely a lot of folks down in the southwest corner of the state for sure.
Well, Sam, do you want to share a little? She said southwest part of the state. So not that it is different and it's the same programs, but the way we've kind of approached it may be a little bit different than even other parts of the state have. So do you want to talk a little bit about kind of the history of mental health first aid in Southwest Missouri, Springfield, Greene County?
Sure. So like Rachel said, Missouri was one of the first states to adopt this. And in 2012, our Prevention Resource Center got a contract with the Department of Behavioral Health. And so we were able to start a little bit doing some youth mental health first aid and adult mental health first aid in our 21 county region. And from there, we wanted to do even more. So we got a grant with SAMHSA, and that was in 2015, and that was a 3-year grant. So it ended in 2018. And that was specifically allowing us to do youth mental health first aid in Greene County. We continue to have that contract with the Department of Behavioral Health, but we were able to really flood Greene County with more more trainings and kind of do a lot more with that, including, more regular webinars and forums, and do a big conference for people once a year, things like that. And through that grant, we trained 1,700 first aiders in Greene County throughout those 3 years. And then we wrote for another grant that's super similar to that started in 2018, and that ends at the end of September of this year. And that allowed us to kind of expand and do youth mental health first aid, but also do adult mental health first aid in Greene County. And we're at a little over 1,200 people trained now. And also through that, we collect the number of referrals. So we send out a survey every month to see if people have utilized the skills that they learned and referred individuals to either self-help strategies, professional help, or some other type of support. And in this grant, we've had a little over 4,500 referrals. In the grant before that, we had even more, something about people not wanting to respond to a survey every month, which is completely understandable. But if we combine the last grant and this grant, we're at over 21,000 referrals in Greene County alone. So it really does show that people are learning and that there's people in need in our community that really need first aiders. So yeah, that's a pretty significant number, and just excited that, people are using those skills, and we've been able to train a lot of people in that. So that's kind of the background on what we've done here.
Rachel, is there been any kind of capacity to measure that impact in the state? Like Sam said, we've tracked the referrals. Maybe you've not tracked referrals statewide, but is there a way to measure kind of the impact of 60,000 people being trained?
Yeah, I think that's the $1 million question, Steve, and is something that I think nationally we often try to get our arms around and try to understand. It's so tricky, because ultimately our goal is to improve the lives of people experiencing mental health challenges and to save lives. And it's hard to measure that end outcome. There are some studies that are going on nationally. I can't say that we've done any statewide outcome tracking, but there's actually, I might put a link in the chat box here in a little bit for folks to spread the word. The National Council nationwide has really beefed up some of the research things going on lately. So they have a new research advisory board, and they have a new small grant opportunity for PhD students right now to really try to get researchers into the pipeline to really focus on producing more and more research for mental health first aid. So there's some cool stuff that's happening. We do have some research that is established in some of the outcomes that we know the program produces. This usually measures the outcomes from the people who have taken the class. So we call them first aiders. So when you attend a class, you're a first aider. And we know that of people who've taken the class, they show an improvement or increase in mental health literacy, right? So knowledge about mental health, right? Which makes a lot of sense. It's a class training us about mental health, but it does what it says it's going to do. And that improvement is actually, or that increase is actually much greater for people who didn't come to the table with past mental health knowledge. So we see folks who may not already be social workers or counselors show more of an improvement and more of an increase in mental health literacy. There's also a reported increase in confidence. So people report that they're more likely to be able to reach out to someone. People show an increased awareness of mental health resources and say that they're more likely to be able to connect someone to a mental health professional. So I think that speaks, that's kind of the precursor to that message that Samantha said about how many folks are actually using the skills. And then my favorite little piece of data too is that of people who have taken the class, people show an increase in mental wellness, which I don't think is necessarily like the intention of the training, right? We kind of go to the training thinking I'm going to help someone else, but just by talking about mental health, people show an improvement in their own mental health. And I think that's kind of a really cool, maybe unintended benefit of the program that, you know, we all benefit just by talking about mental health and being more open about it.
That's great. Yeah. Any questions from the audience thus far for either Samantha or Rachel?
Since I committed to question.
Yeah.
Since I committed to implementing teen mental health first aid in Webster County, would you talk a little bit about what I got myself into?
Let me I'll give a quick outline, and then maybe Samantha, you can talk a little more specifically about teens since you're very familiar. So we've tossed around some of these terms, but for folks who may be newer to mental health first aid, so we have 3 core curricula. We have an adult curricula that trains adults who would support other adults experiencing mental health concerns. We have a youth curricula, which trains adults who support adolescents, primarily adolescents aged 12 to 18 right now, although they're looking to expand that to also include elementary age youth. So there's some information right now in the manual that people receive that addresses the elementary age. And I think hopefully within the next couple of years, we might see more of a curriculum developed around that. And then the third component is teen mental health first aid. And we are so excited about that because people have been asking for a long time. The teen mental health first aid trains teens to support each other, right? So the people who attend the training are either 10th, 11th, or 12th graders. And Samantha and the CPO folks were actually among the first folks to do this nationwide. So I'll let the experts speak to the rest of that.
Well, feel free to jump in, Rachel, because I know that you kind of have even more up-to-date information than I do, because it is still so new. So there are still, updates coming and, tweaks that have been made since I became trained. So feel free to jump in. But yeah, with teen mental health first aid, it is a little bit of a different thing that you have to think through because you're going into the classrooms and doing these trainings or going into the school and doing these trainings. So it is a lot of collaboration with the school, figuring out how will this work best. And the reason behind that is that you either do 3 sessions that are 75 minutes or 5 sessions that are 45 minutes. Is that correct, Rachel? It's been a while.
I think it's 6 now. They upped it to 6, 3 90-minute or 6 45 minutes. So they
okay
a little bit because it was so much information in such a short amount of time.
Yes, perfect. Thank you. I'm glad you're on here today. So with that's a lot of logistics that you have to figure out when you're going into a school and taking students out of their classrooms that long. So some of the things that we did was think through what class all students have to go through. And with teen mental health first aid, you can't train freshmen. It's only 10th, 11th, or 12th. And we specifically focused on 10th graders. So then they had this information for as long as possible while they're in high school. And so we chose a class. I believe we chose history because all students had to go through the same history class, and pulled them out of there and figured that all out logistically with the school counselors. The other thing too is you need to have another school staff in the room and also make sure you have counselors on hand so that students are able to go talk to someone at any time. But we really got some amazing feedback from students on, feeling like they feel a lot more comfortable reaching out to a friend if they're struggling. They know more how to have that conversation. They have a better idea of who the trusted adults are in their life that they could reach out to or that they could bring their friend to. So it really does equip them and make them feel a lot more comfortable with getting help for themselves or for their friend. So really incredible training. Trying to think if there's anything else, but let me know if you have any other questions. Oh, I will add one other thing that's super cool about the training is after every session, students fill out an exit ticket, and it's a great tool. They circle a little emoji on how they're feeling. They write down something that they learned that day. They write down if they have any other questions, so you can answer those at the beginning of the next session. And then they also say if they need to be checked in on. So that's a great tool because even if they weren't willing to maybe, get up in the middle of a class, they were more willing to, or you could reach out to them directly and talk with them after the class that day. So yes, that is kind of what to think through, if that helps.
And Samantha, you mentioned some interesting things that made me think of some of the data. So I have a little bit of kind of preliminary teen evaluation data. I'll share it on my slide on my screen here. So folks can see. So one of the things that I think is interesting is, right, teenagers are not always like super enthusiastic about things. And so while most people who take a mental health first aid class are like really jazzed about it after they leave, we know that these are significant increases for teens, right? Because I think they're honest and tell it like it is. So 35% of students felt more comfortable asking a friend if they were thinking about suicide. 35% more students felt confident to help a friend in need. And 37% less of students said they would avoid talking about suicide with a friend. So I think that's huge. And then speaking to the exit tickets that Samantha mentioned, right, that we see that 505 students asked for help after the training. And that's I don't know of what number that is of, but it's a relatively small number. It was, I think this is still from with less than 30 schools implementing. So that's a pretty significant number of folks who got help as a result of taking the teen mental health first aid class, some of whom got help from that exit ticket. So, and a lot of students said they'd recommend it to a friend. So I think that's that speaks volumes coming straight from adolescence.
Let's put a pin in the teen and come back in just a second. Kim Reeser, and Kim sent me an email that she wouldn't be able to stay for the entire time. And she has a question, and I want to see if we can flesh it out and answer it for her before she has to leave. Is there a specific training for the senior population? And are you asking, Kim, I'm assuming like to help seniors or for seniors to be trained? There is as I understand, there's a module that's a part of the adult mental health first aid that specifically targets the senior population, how to engage, interact, that kind of thing. So if that's what she's asking for both. So can you talk a little bit about that, Rachel?
Yeah, so I'd say yes and no, kind of. So it's complicated, but so I think that any of the classes would be appropriate for a senior to take themselves to be a first aider. And then we have a module of our adult curriculum. So our adult curriculum kind of is this core piece. We have a few versions that help to tailor it to specific audiences. So we have one for folks who might be supporting or working with older adults, which could be appropriate for older adults to take themselves as they're thinking about supporting their friends or family. And then we also have fire and EMS, public safety, higher education, military members, veterans, and their families. So there are some ways that the program can kind of be tailored. I'm going to put like a little caveat on that, and that right now we're in the midst of a big change in the curriculum. And so for the updated version of our curriculum, those modules aren't yet available. And so we could help you find somebody who could do the modules kind of with an in-person, but not all of our instructors right now will be able to deliver those modules. They're going to be updating those and kind of refreshing them here over the next year or two. So we anticipate again pretty soon that they will be available. Just at the moment, there are some logistical challenges to figure out there. So let us know if we can help you with that. If you're looking for someone who can do that, we can help to sort through who might be certified to do that class. And that the module classes would right now be delivered totally in person.
Okay, thanks, Rachel. So in talking about the teen, and I think, Scott's asking, he's part of the Webster County Health Unit, and they've submitted their is it maternal child health grant for the next 5 years, and he's going to focus on mental wellness in the county, which is fantastic. But you're talking about how to roll out the teen aspect of it, and are you asking, can people get trained to be teen facilitators in Webster County? And if not, how does the people that are trained come up there and roll that out? Is that what you need to know as well, Scott, or?
It is. And actually, I got some good notes down from what Samantha and Rachel covered. But yeah, certainly becoming facilitators is going to be important for our staff. And is that something that's also done with 2 instructors?
It can be, I don't know, Samantha, do you want to speak to your experience there?
Yeah, honestly, we did most of ours on our own. We started out having a co-facilitator, but since they are such shorter segments, especially if we did the 45-minute one, but even the longer one, we just usually just used one staff, so we didn't have to use as much staff time, and it was just logistically easier. Sometimes if we did, a whole day where it was one class, okay, backtrack real quick for a second. So you cannot train every single session in order for the same students all day. So you couldn't have just students stay in the classroom for 6 hours or whatever and train them in the whole thing. You have to have, it has to be the next day or so. So, but we would have multiple classes in a row of different students coming in and doing the same session over and over and over. So with that, we did switch off staff so that we didn't have to be there all day doing the same session every day. But you don't have to do that either. That just seemed to make it a little easier on us mentally.
And
sorry, that was kind of all over the place.
What about as far as training trainers? Because I know like Rachel did one yesterday, but what about what's the capacity for new trainers in the teen format at this point?
Yeah. So Missouri is a kind of a special place in a lot of ways. So because we help to bring the program to the United States, we do our own in-state adult and youth instructor trainings. We are still exploring the feasibility of doing our own teen instructor trainings, but as of today, that has to happen. Teen instructors need to be trained through the National Council. Our team is happy to connect you with them and to connect you with those trainings. And we're exploring that possibility for the future. But at the moment, it's going through the National Council.
Do you know, are they actively training? I mean, because it's still,
Yes.
Quote, in a pandemic, are they doing training? Because that's a big undertaking if you're going to virtually, if you're live. So where are they at with that right now?
Yeah, so the National Council is doing teen instructor trainings, and actually both Missouri and the National Council right now are delivering all instructor trainings virtually. So we anticipate post-pandemic that there may be some level of that happening still, because we found people don't love to pay for travel expenses. So it makes some of the feasibility of it a little bit easier, but the teen instructor trainings are happening now, and they are happening virtually. And I should note that the teen course, while originally designed to be delivered in person, and I would guess probably more effective in person, does now have an option to be delivered virtually too. A lot of safety pieces in play there, but just in case schools aren't able to fully open up or have to go into a virtual mode, there's some adaptability to that too, which I think it may come in handy. Hopefully it doesn't have to come in handy, but may come in handy.
Okay.
Can I add a little bit to that real quick?
Yeah, go ahead.
Just in case there is anyone on here or someone watching in the future, the recording, that is super interested in having us come and do the team mental health first aid, we have very limited capacity and funding. So we're really, at CPO, our staff specifically is not really able to come into the schools and do those at this time. But if you are ever interested in that, reach out to me and we can kind of see what that can look like, or see what we could maybe get scheduled for the future, or who I can connect you with. But right now we do not really have the capacity for that at this time.
Okay. So Cindy dropped off, and so we can get connected with her afterwards. She wants to get trained along with some others at the Lighthouse. So she put her email in the chat box there. And then Chris Davis joined us and said that there's staff from CPO and the Springfield Greene County Health Department that are trained in the module for older adults. So
There you go. Perfect. Thanks, Chris.
So, and there may be people in the audience that you've talked about, there's 3 different curricula. There's also a variety of ways that it can be delivered. There's virtual, there's blended, and then it's the new curriculum's really not ready for live, like 100% yet. Like that's not been approved. Is that correct? So can you
That's
talk about each
correct.
one of those and what they look like?
Oh man,
So-
yeah. Sometimes my head spins with the terminology here. So I think the key message is if you need help, come find us. We're happy to help, or come find Samantha. We can help you navigate. But there have not been a lot of blessings of this pandemic, but one has been that we've been able to adapt a little bit and to deliver the class virtually, which has created some increased accessibility to the class, which I think is really, folks are just interested in taking it from their office or from their basement, and it makes it a little bit easier rather than having to drive somewhere to get folks together. So we are in a lot of phases. So we have an old curriculum, we call it 1.0. It can be delivered totally in person. Both the youth and the adult are 8 hours. We have a new version of the curriculum. That's what we will shift to eventually. So the old one will go away. The new one's updated with some new statistics and data, and some new formatting and videos even. So there's lots of good stuff in the new one. And the new curriculum can be delivered 3 ways, right? The fully in-person way, which is to be coming pretty soon, hopefully sometime this summer should be available. We've shortened the youth curriculum to be just 6.5 hours to fit in a teacher schedule. That's been a big request that we've had. The adult is still close to 8 hours long. So 6.5 hours for the youth, or we know sometimes even that feels like a long class. And so we have blended learning options where people on their own pace can take 2 hours of learning. So they do 2 hours of self-paced at their own computer learning, and then come to part that an instructor facilitates. And that part that the instructor facilitates can be either in Zoom like we are here, or it can be in person, like physically sitting around tables together. So that's kind of the blended or the virtual options as well. And then the part that the instructor facilitates is 4.5 hours if it's a youth class, or 5.5 hours if it's an adult class. So if you're going cross-eyed from all of those terms, I'm with you. I'm with you. Just, it takes about 6.5 to 7.5 hours to take a class, and there are lots of ways you can do it.
And I'm assuming that there's a plan or an idea in place that even going forward, those formats will still be deliverable. Even if tomorrow we could all do these live and in person, there still would be the capacity to do a blended or a fully virtual.
Yes, yeah, that is the plan for those all to stay as an option.
Because I know that's one of the things now that Amanda Foster is trained in the adult version. We both work with a coalition that is wanting to do a training, and they're going to have to wait until we have the blessing of the live version, because a lot of their membership is a very, very rural location, and they are not comfortable with technologies, and training them in this format just would not be conducive. I mean, some of the members don't interface with computers. They don't use email. They just don't use,
Mhm.
you know, this modern form of communication. So it'll have to be when we can meet in person. So that's what's exciting about this is there really isn't a reason why someone can't learn from mental health first aid because it's available in so many deliverables. So.
Well, and I think, Steve, that makes me think about how, you know, kind of the model for this program is that that instructors who are in their communities are the ones delivering the classes. Now, granted, now my community might be a virtual one and could be across the country, but you know your community the best. And so that's why it's so important to have someone like Amanda who knows my folks aren't going to show up to a virtual class, right? This is much better delivered in person together. And then we might have other folks who say, oh, my folks only want to be in this virtual environment. So there's a lot of benefit of having some sense of community in that class and having people who know their community and the specific concerns and needs be able to address those and the specific resources in that community. And community, right, very broadly speaking, there can be lots of different definitions of community.
Questions from the audience, as we've talked about a lot of stuff. I mean, there's a lot available through this, which is exciting, but you know, if we need to clarify some things, questions about how to get trained or bring a training to you, to your community.
Well, that's a great point, Steve. While folks are thinking about questions, so we have some classes that are like open to the public that individual people can sign up. But if you have a group of 20 folks and you're interested in, or even maybe less than that, depending, like if you have a group of folks, definitely reach out because it's also possible to do it in sort of this in-service or group format where a class can come to you.
Hey, Rachel, I have a quick question, and I apologize if you've already covered this. I know teen is much newer than the others. And we also know that SAMHSA has, for the last several years, have had larger grants for mental health awareness training and so forth. Do you know if there's been discussions or if there are things in progress where eventually teen might be included as an option in that? And if so, any timeline on that?
Yeah, I have some information, but probably not a perfect answer to that, Chris. So I think at the state level, there are some good conversations going and even starting to kind of have some conversations with DESE or the Missouri School Board Association about what this looks like and what funding options might be available. I think the Department of Mental Health wants to be supportive of the teen program. It's just tricky with limited resources to figure out how to do that best. There are also some other avenues that we're seeking out, even with some other grants that the state currently holds too. So I'm hopeful that at the state level, there may be some more support because that's maybe one of the undercurrents that this is not a cheap program necessarily. It takes some financial resources. It's a valuable program, but it's not inexpensive to administer. So I'm hopeful that there are a few things brewing. I told Steve this morning, like some irons in the fire in the state of Missouri. I don't have great intel from the, in terms of the SAMHSA funding about whether or not it will specifically be toward teen. I know that the National Council has been advocating for that and has been requesting that it be available. And I do know, so the most recent SAMHSA grant that was available, I know some people wrote teen into it. I'm not sure, we haven't seen the funding requests come out to see if that was a successful proposition or not, but they wrote training teen facilitators into it because those people are adults. And so I think they've tried to broaden the sense of the scope to see if it could cover some of the teen. And so I think that may be a good tell as to what might come in the future. And if that kind of same funding stream that we have seen will be more broadly available to teens. So it would surprise me if it if it wasn't at some point. And I do know that that funding stream has been renewed again for the next fiscal year. So I would expect that there should be a similar grant opportunity to the Project Aware or the Mental Health Awareness Training Grant. It's come under a couple of different names. I would expect that again in the next fiscal year. For there to be another opportunity available. So I don't have great insider information, but that's the general sense that I've had so far.
Other questions? Well, like I said, every time we get, have like a state before the prevention conference, there may be a day where we talk about, mental health first aid, and trainers get together and you kind of deliver some of the latest information and training techniques. And then there's always a chance for us to brainstorm and think outside the box. So the question always is what's the future hold as far as, in your crystal ball, like, boy, if we could just go in this direction, or if we knew more about how to do it, in this particular way. I know we talk about marketing, we talk about funding, we talk about, ways to get people, in the seats. So what's your future look like for this, Rachel? If you could say, ding,
with my magic wand, right? I think I've always been surprised at like the direction the future holds. So I'm not sure my crystal ball is working totally, but I am excited because I feel like we are in a little bit of a new era of mental health first aid. And I would be interested in hearing some ideas from folks here too about what audiences might be next. I think that we have trained a lot of people who work in human services or who work in kind of behavioral or mental health fields. So I always think of that as kind of the low hanging fruit, the people who are like, oh, a training about mental health, I'll sign up for that. And I think though now I'm starting to see some shift in that, and that certainly some of those folks are still attending, but we've had some kind of new and interesting audiences. Missouri's Department of Natural Resources, for example, wouldn't necessarily have been the first place that I was like, oh yeah, they should take mental health first aid, but they come into contact with the public at a really high rate, right? When you're thinking, especially like during a pandemic when everybody's going to parks to be outside, and they have had a huge initiative and are also conceptualizing it as wellness for their employees. And so I think I'd be interested in brainstorming with you all, like who might be some of those next groups that, they have been like left and right, Samantha. I think almost all of the trainings I've been doing lately, we've had Department of Natural Resources folks, and they're really excited and receptive to the class. So I don't know, I think there will be other groups like that once they start attending the class, we're like, well, of course that makes sense, but haven't necessarily been the people that we've thought about for marketing in the past. So I don't know. I don't know if folks have other ideas. I think that's one of the things that I'm interested in hearing from you. And sometimes the program, as large as it is really kind of grassroots sometimes in terms of coming from community coalitions or recognizing that local need and saying, how do we meet that? Who are the people who are around our community that need this training?
Well, when you talked about the Department of Natural Resources, I know when we started doing a lot of the mental health trainings in the Springfield area, of course, we had teachers that were involved, and like you said, people that already work in some form of behavioral health, but the librarians were also very interested in the same reason, the volume of the public that come in to the branch locations or the libraries here locally, and not even locally. I mean, I think we trained the librarians in Pierce City. So so that was an issue. Have there been other like pockets of that, from other regions? You're primarily everyone right on this call is Southwest Missouri. Have there been other like, in the time you've been doing this, like, I remember that in Kansas City they did it something, or, down in the Boot Heel, there was a group. Have there been others across the timeline that maybe we don't even know about, that's an audience we could go fish in?
Yeah. It's That's a
What do
good
you think
question.
about
Let
that?
me think on that a little bit, Steve. I'm trying to think. I'm sure there have been. In fact, like there was a big push for librarians really at the very beginning of this. I think we've seen some good concerted efforts in faith communities too. There's a group in St. Louis that I think does a really awesome job of connecting mental health first aid along with some other things in the faith community. So they kind of certify churches as like behavioral health friendly churches. And so they have like a certain percentage of folks who are trained as mental health first aiders. And then they have some other resources available too, in case they want to do a sermon series on mental health or a Bible study on that, and have some kind of faith specific resources. So it's been a neat thing. It's been targeted primarily Black churches in the St. Louis area, but I think has some really good learning to take to other communities as well. And I might be able to grab their website here in a moment and pop it in the chat box too, but I think that that makes a big difference.
Samantha, has there been some groups that, maybe wasn't aware of, and as we've been doing it, that have kind of like, well, that's interesting. I know we did some colleges, nursing students, which was a good audience to try to reach because of, they're in that between, being the adolescent themselves and then moving into a professional career, and of course they're going to see a large population of the public, because of healthcare. So.
Mhm. Yeah, we had also occupational therapy students go through it as well, which I thought was really cool because, they would be consistently working with the same patients and making those connections and being able to have those conversations. So that was great. A population I'm trying to work on is athletic trainers. My husband's an athletic trainer, and they are working with students all day long, and they are not school staff. So they have kind of that unique relationship with students. It's been very hard to get them trained, so that hasn't happened yet, but that would be an awesome audience to be able to train because students feel really comfortable opening up to them, but then they don't know what to do or say when they do open up to them. So would love to get them trained. Yeah, I'm trying to think of some other more unique ones.
I have a meeting this afternoon actually with someone in the construction industry. Industry has one of the highest rates of suicide. And so my husband works in the industry, and we've been having conversations just about mental health as a safety measure, right? Like when those construction and architecture companies put a ton of money into safety. And when you think about like the safety and the well-being of your employees, whether it's related to suicide or substance use or anything else related to mental health, I think there's some funding accessible there, right, to be able to really broadly disseminate thinking about, maybe site supervisors or folks in HR at those kind of organizations.
Something else too that I think would be cool, the Stand Against Trafficking Coalition in our area has been trying to do more, they've been trying to reach out more to, I can't think of the actual term, service providers or something. So it's, plumbers or, people like that come into the homes of people on a regular basis to do some type of work. And I think that industry would make a lot of sense because they're interacting with people on a regular basis and are in their homes and might notice something that other people would have no way of seeing those types of warning signs. So that type of group of people would be awesome too.
We've seen some, there's a group in St. Louis. Amanda was just in a training with the group in St. Louis, and they are working on training barbers and beauticians, right? Because who do you sit there and talk to for an hour every 6 weeks? There's kind of a cool connection there.
Yes, that is when we did. Scott and I did that. We did students in a hair academy. So it was like part of their classwork that they had to go through adult mental health first aid, which was awesome.
I do love capturing students, like whether, kind of pre-professional folks, because I just think that a lot of times they have a little bit more time, or it can be part of class or part of an assignment. And so as you're thinking about professionals, right, like the future professionals might be a great place to start those conversations.
Yeah, I
Yeah,
remember that. Chris said we trained utility staff and media comm technicians, so in the service industry. Other people on the call today? I mean, does this trigger ideas for you that you could share with us? Not that you necessarily have done it, but like, well, that'd be interesting if we targeted this particular. I know we've done law enforcement. Um,
I think it may be interesting maybe to look at restaurant workers. I know that industry has a really high instance of substance use and misuse just in that working in general. So it would probably feel like it would be more coworker to coworker, not necessarily coworker to like the person you're serving, but it might be interesting.
For sure, for sure. Well, and I think I kind of like it sometimes when it is that coworker to coworker situation. Sometimes I think people come to the class thinking like, all right, I'm going to do this for the people that I serve, but I probably spend more time with my coworkers than the people that I serve. And so, yeah, being able to support each other in a stressful line of work.
That's one of the things whenever I set up the training and we talk about, today's agenda, so to speak, is not only did you come in here wearing your hat as the professional, whether that's a teacher or a professional therapist or fireman, or Scott and I did the EMS, the training. So that there's that professional 8-hour shift. But don't forget that at some point you take your hat off and you're Joe Q public, whether that's in the checkout line at the store or at the park, and I think sometimes people just get locked into like, I'm doing this as a professional, so this is a professional duty, like on the job, so to speak. And I find it just as valuable outside of that realm, because there's still 16 more hours in the day where I may run into someone who, is in a crisis, or someone needs to just talk about, someone that they may know, that kind of thing, and get them connected in some way or another. So, and I think sometimes even saying it at trainings, I think sometimes people still have a hard time disconnecting from the identity that this is a job related type of training that I'm going through.
Mhm. Yeah.
And I think the valuable part of that is what reason and it's the reason I wanted to do be a trainer for mental health first aid, was because you never stop breaking down the stigma. And that's the whole reason I talk about it all the time, is nobody else is talking about it.
Yeah.
Well, now there are over 60,000 people in Missouri talking about it, but people just don't talk about it. It came up in a conversation last night after work. Somebody just asked me what I did, and they said, well, what does that mean? And then I mentioned mental health first aid, and the whole conversation shifted about the need for it and the people that they see in their line of work. And it's like, it's good to talk about that kind of stuff.
Mm-hmm.
So I have a thought. I know you talked about doing it with the schools for teens and so forth, but a lot of times there's a big move for tech schools now. And so those tech kids aren't actually at the school in the afternoon. So maybe doing a program at a tech school for, you talked about construction being a big issue. So things like that.
Yeah. Yeah, absolutely. That's a great point. And that team can be implemented in schools or tech schools or other youth serving organizations. So like a Big Brothers, Big Sisters, or after school kind of program has the option to implement teen there as well. So yeah, that's a great thought that again, thinking about the kind of the pre-professional, a great place to connect you as you are a teen, but also then some good transferable skills into the workforce.
Chris put the suggestion that the theater community in Branson, maybe we can get, Soji Tabuchi to do a 1-act,
Love it.
What is mental health first aid live in Branson?
Love it. I will travel for that.
There's your marketing tool there, Rachel. Maybe we need a 1-act play by the Branson troupe, and then people will be like flocking to a training.
Yeah. I have seen a lot of the arts community recently. We've had like groups of like a dance ensemble. I feel like a lot of the arts community has been really open to this. So that's like, love it.
Steve, we have that. It's just an 8-hour one-act play right now.
Well, there's a coalition that I work with in Lawrence County, and they worked with the high school theater group, and they did 6 one-act plays, and they were all like, I think they were like 7 minutes or something like that, and each one of the kids took on this role of, addressing a particular issue like underage drinking or suicide prevention, and they did it. They did it for their school, they did it for the parents, and then they went to several of the smaller schools around the area and did that for, I think, like elementary students. It's kind of like a peer-to-peer thing, and I just thought that was interesting. And I don't know that they got into like the mental health aspect, but I know one of the teams did something on suicide awareness. So be interesting to do something like that, just to create people talking about it and asking questions about it.
It reminded me too that one of the things that I really love about our new curriculum is that it features artwork from individuals who have lived experience with mental health concerns. So our teen and our youth curriculum feature artwork from teens and videos of actual, like, real teens, not just actors portraying things. And I think it's so powerful to involve the voices of young people themselves. And I think young people are talking about it and are open to the conversation and even asking. Like, I've seen some schools that I'm working with who are interested in teen. It's because the teens came to them and said, we need this training. And so I think, allowing that space for their voices and really elevating their voices is huge.
My experience has been with that. The teens talk about the art much more openly than getting the adults to engage. Like, what's your understanding of this? Or, the teens will kind of tell you what they think's being said.
Yep.
Any other questions or thoughts for Rachel or Samantha?
I see a great thought from Jillian in the chat box about, thinking about field reporters and covering traumatic situations, right? So like thinking about the anniversary of Joplin. That it could be a great resource for their own mental health and thinking about the folks they may encounter as they're interviewing folks.
Yeah. All right. Well, if there's no other questions, I want to thank both Rachel and Samantha for coming on today and telling us a little bit about, I think it's a valuable resource and it's a great topic. And like I've already, shared, I talk about it all the time, just because it just seems like nobody else is. So sometimes it opens up conversation and sometimes people are ready to go home. They just don't want to talk about it. So let's talk about it anyway. All right, the next prevention perk is June the 3rd, 8:30 a.m. We'll send out invites and we'll be talking about epidemiology. And I'm hoping for a huge audience for that because I don't want to be the only one there that doesn't have any idea what epidemiology is. And Clement's going to do a great job of at least educating me on the subject. And I'm sure those that are also going to be in the audience as well. So thanks everyone for being here today. And hopefully we'll see you again soon.